Oh no. This is a picture of the Scutellaria siphocamphiloides, which is the native Scutellaria for where I live. So I was just looking in iNaturalist to see if there were Scutellaria species native to Switzerland. Apparently there's 3 or 4, which might be blooming right now. So anyway, Baicalin is one of the major active constituents in Scutellaria baicalensis, which is the genus and species of Huangqin. Berberine is the major alkaloid found in Huanglian and Huangbai, and also other things like golden seal and various other plants. So Baicalin and Berberine are the representative active constituents in Huangqin and Huanglian. And Huangqin and Huanglian are 2 of the major heavy lifters in the formula Banxia Tang, along with Renshen and Shengjiang, Dazhao, Gancao, and importantly, Banxia. So a little background on what is anti-PD1, PD-L1 therapy. So we think about the immune system function, and you're like, oh, I should just strengthen the immune system. Frequently the problem with the immune system is that it's overly suppressed. And so then you end up needing to treat the suppression. I need to suppress the suppressors. In some sense, I make a positive with 2 negatives. So I strengthen the immune system by relieving the suppression of the immune system. This is like the theory behind the immunotherapy, where the PD is the programmed death and the PD-L1 is the programmed death ligand. The PD is the receptor for the ligand. And so these are expressed on T cells essentially, and it's a normal process because if you don't suppress activation of the immune system, the standard side effect of that would be an autoimmune condition. Whereas cancer creates a condition of immunosuppression to facilitate its survival. One way to think of that is, to introduce that idea, is cancer hijacks a lot of different machinery. One interesting perspective on cancer is that cancer is similar to a wound that doesn't heal. So when you have a wound, there needs to be tissue regeneration, and it's like a construction site. You're building all kinds of new tissue. And I have to build extracellular matrix, I have to build a vascular system, I have to induce angiogenesis to create blood vessels, like to create so you have the pipes for the water, the fluids, the electrical system, there's new neurons being developed, and then there's all of the, the brick and mortar aspect of it. When that tissue is being built, it can trigger the immune system because it doesn't possess all of its normal antigens on its surface, so the immune system might see all these new buildings being built and decide that it needs to destroy it. So in the context of when all of this machinery is going on to build new tissue, in conjunction with that are immunosuppressive signals to suppress the immune system so it doesn't destroy the construction site in the process. And cancer hijacks this in some sense. So while the machinery is active, the immunosuppressive signaling is occurring, the tumor is allowed to progress. Other conditions can facilitate that, and we'll get into that now. So one of the starting point actually is here, this journal article from the New England Journal of Medicine, which was PD-1 blockade and mismatch repair deficient locally advanced rectal cancer. And it was so great because it was 13 patients, 12 patients, and they all had a complete response to this therapy. And it's a monotherapy. Once every 3 weeks for 6 months, they receive an injection of this anti-PD-1 antibody, and then that suppresses the suppression of the immune system. The immune system is then able to completely exterminate their colorectal cancer. And you look at that, and then people react to that, and they're like, oh my God, it's a cure for colorectal cancer. We've cured cancer, and it's 13 people, and it's a specific population, this mismatch repair deficient, and so this creates a certain condition within them where they are mismatch repair deficient, means they accumulate a ton of mutations in their DNA. Those mutations cause the tissue that's generated to essentially highly activate the immune system. That activation causes a response where there's then a huge expression of PD-1, PD-L1, and then there's overexpression of PD-1, PD-L1, and so in that sense, that cancer, because of that condition, all you have to do is reduce the amount of PD-1, PD-L1 that's present, and then you'll get a total response via their own immune system. And this highlights something very neat about immunotherapy, which is that By modulating the immune system, we can achieve great results in cancer, and this is the promise of immunotherapy, where we don't have to use cytotoxic chemotherapy. Theoretically, there's less side effects, but it's always like but there are side effects because immunotherapy can induce autoimmune responses, so on and so forth. So we see initially great promise, but it's highly limited. That mismatch repair deficient population is about 13% of colorectal cancer patients. So it's a very small proportion of all colorectal cancer patients to begin with. If we extrapolate to cancer in general, the response rates are usually somewhere in that range of like 15 to 30%. And so we immediately try to understand how we can make this therapy more effective in a larger population. And then we must understand what are the limiting factors on the effect of actually, I guess I didn't even talk about that. No, this slide, yeah. Okay, so how do we make it more effective? The first thing we have to understand is the tumor microenvironment. In these cases that we're interested in, it's this immunosuppressive tumor microenvironment, which can generally be described as a cold tumor microenvironment, in that it's not really responsive to immunostimulatory signaling. We would like to convert a cold immuno microenvironment to a hot immuno microenvironment. And I wanted to make a joke about the climate, but that was not going to come off well. So generally speaking, we see these immunosuppressive cells like PD-1, PD-L1, the ligand and the receptor, and then there's another immune checkpoint, the CTLA-4, and then there's immunosuppressive cell types like the MDSC, the myeloid-derived suppressor cell, and then also the T regulatory cells. These are all just generally suppressors, are involved in turning off the immune system response, turning it down. They can be upregulated by other factors like stress, inflammation, excessive signaling through vascular endothelial growth factor, and its associated receptor, and also transforming growth factor beta. These are the kind of part of that machinery of inducing proliferation of cells by transforming the tissues and creating angiogenesis, creating new blood vessels. And then there's regulatory types of macrophages, type 1, type 2, tumor-associated macrophages. You want to convert the suppressive 2 to the immunostimulatory 1 and T helper 2 to T helper 1. And then there's the standard cells that then attack the tumor, the dendritic cells, the natural killer cells, the cytotoxic T lymphocytes. So we have this kind of general idea. This is all happening in the tumor microenvironment. You have all these different cells, immunostimulatory, like the standard cancer-fighting cells, the regulatory cells, the suppressive cells. So we have various methodology to try to convert these favorably to transform a cold microenvironment into a hot microenvironment. That's the localized area around the tumor. And so then another major site of action, of influence upon the efficacy of immune checkpoint inhibitors is the microbiome, the intestinal microbiome. And so we see this like close relationship between dysbiosis and a failure of immune checkpoint therapy, dysbiosis and immune suppression. The microbiome itself it kind of turns on all these pathways which are synonymous with the larger theory of what are the hallmarks of cancer, where we have the tumor promoting inflammation and the immune escape and the promotion of invasion and metastasis and so on and so forth. So there's this larger mirroring of the influence of dysbiosis on turning on these pathways and how that then is mirrored in the local environment of the tumor. But as far as the immune checkpoint is concerned and immunosuppression, which is one arm of this larger picture, we can look at evidence like what is presented here, where we look at the influence of antibiotics on immune checkpoint inhibitor in non-small cell lung cancer therapy. And you find if antibiotics are consumed early on in the treatment, then there's a reduction in observed survival, progression-free survival, observed response rate So dysbiosis associated with the antibiotic use is going to reduce the efficacy of the immune checkpoint inhibitors. And also, on the contrary, an increasing diversity of the intestinal microbiome is associated with an improved prognosis in non-small cell lung cancer immunotherapy. And specifically, the abundance of Bifidobacteriaceae is associated with a greater degree of responders than non-responders to immunotherapy. On the contrary, a low abundance is associated with worse outcomes. So we start seeing the role of the microbiome. A lot of these species, like Lactobacillus, Bifidobacteria, are associated with the production of short-chain fatty acids. The short-chain fatty acid production is another marker for the efficacy of immunotherapies. The major short-chain fatty acid is butyric acid. And so we want to track. So when we think about Baicalin Tang, generally we want to try to observe the consequences of it in these two domains. One is being the tumor microenvironment, the other is the intestinal microbiome. And so we will ask those questions generally, thinking about, does it resolve dysbiosis? Does it increase short-chain fatty acid production? And then thereby, does it resolve immune suppression in the tumor microenvironment? And then how does it alter the immune cell balance in the tumor microenvironment itself in a more localized way? So a lot of the research looking at Huangqin is typically done through the lens of the isoflavones, Baicalin and Baicalin. Baicalin is with the sugar attached, the glycone form, and then Baicalin is typically going through the intestines and being absorbed. The sugar is removed, it is converted to Baicalin, so Baicalin is then therefore more bioavailable in the system. And we find, looking at the effects on the microbiome, treatment with Baicalin, or in this case, treatment with the polysaccharide extract from Scutellaria baicalensis increases the abundance of bifidobacterium, lactobacillus, and these other short-chain fatty acid producing species. And then we just remind ourselves that short-chain fatty acid production is positively associated with anti-PD1, PD-L1 therapies. And in the tumor microenvironment, Huangqin or Baicalin and Baicalin have robust anti-tumor effect. They inhibit tumor growth, they enhance the T-cell mediated cell death, they inhibit interferon gamma, induce PD-L1 expression, and then through a more complex pathway through STAT3, by decreasing STAT3 signaling and therefore PD-L1 gene expression, we reduce PD-L1 expression, and then that allows increased T-cell activity, T-cell sensitivity to kill tumor cells. And so you see that picture. One is the influence on the microbiome, increased SCFAs, decreased PD-1, PD-L1, and then direct attack on tumor microenvironment, direct cytotoxicity, plus upregulation of T-cell activity and somewhat conversion of the microenvironment. Huanglian is similar, maybe not going into all these details, but similar modification of the intestinal microbiome, increasing diversity, particularly in short-chain fatty acid producing species like bifidobacterium and lactobacillus, results in increased short-chain fatty acid production and then reduced expression of PD-L1. The paper, my references are at the end of this presentation, but this paper showed something interesting where independently, if you use probiotics, you would see a similar change in the diversity and in the increase in bifidobacterium and lactobacillus, and then the short-chain fatty acid, and then the effect on PD-L1. Similar effect by probiotics as by berberine. But if you provide them simultaneously, there's no synergistic effect, it actually reduces the effect. Which opens up Pandora's box, right? Because you're like, oh, I don't even need to use these berberine. Obviously I shouldn't use berberine. I should just use Huanglian. I should use the whole herb. But then at some point, you're like, maybe, the primary regression is to dietary therapy. Where like you need to address that. The major way to treat dysbiosis is not through probiotics, it's through a whole foods plant-based diet, a high fiber diet with diverse sets of fiber, actually like natural prebiotic diet where you just provide the substrate for a healthy and diverse microbiome. And then you run into like people with lives and they can't seem to construct a healthy diet, and so you run into the problem of having to treat with drugs. And so berberine, we see some talk about berberine, its effect on immune checkpoints in melanoma, and through a mechanism of increasing radical oxidative species, in the end it increases activation through dendritic cells and CD8 cytotoxic T cells, and synergistically increases the potency of the immune checkpoints in melanoma. And so we see that berberine is a novel immunogenic cell death inducer and is therefore a plausible integrative therapy to work synergistically with immune checkpoint inhibitors. So we looked at Huangqin and Huanglian, we looked at Baicalin and berberine. We could talk more about ginseng and ginger and jujube. Ginseng has both the triterpene saponin active constituents, the RG, the RB, the RHs, and then it also has the polysaccharides that it's mediating its effect through. So on one hand, the polysaccharides are likely to be very important when ginseng is consumed orally for promoting healthy microbiome, and we will see the anticipated responses at this point with increased short-chain fatty acid production and then increased tumor response to PD-1, PD-L1 therapy via predictable things at this point. Gingerol is interesting. There's recently been a published where they're looking at using gingerol, which would be one of the monoterpenes, like one of the aromatic components in ginger, and using that oil essentially, or that monoterpene, in conjunction with immune checkpoint inhibitors in non-small cell lung cancer. And again, we see increased efficacy by inhibiting the PD-L1 expression. Jujube also interestingly focusing mostly in the microbiome using this ultrafine jujube powder in order to increase the abundance of microbiome of particular microbes, increase short-chain fatty acid production, and then inhibit PD-L1, causing increased infiltration of the CD8 and improvement of the tumor microenvironment. So we've looked at the general construct. You know, if we want to quiz ourselves, we could ask ourselves, what herbs did he not talk about that are in Bansha Sheshan Tang? Obviously, I didn't talk about Bansha. Interestingly, Bansha, in certain assessments, the active constituent in Bansha that's actually important is Baicalin and Baicalin. And I was kind of shocked. I'm like, that doesn't make any sense. Why is there Baicalin and Baicalin in Pinellia ternata? But apparently there is. So Bansha Sheshan Tang, this is the picture from the Fuzhang Qilun, the Fukushin Kiran in Japanese, I guess, is the extraordinary patterns of the abdomen, like one of the major abdominal palpation texts. This description of the abdomen of Bansha Sheshan Tang says, there's glomus and fullness under the heart. When pressed, there's hardness but no pain. There's vomiting and thunderous rumbling in the intestines. It's a formula for mistreatment due to purgation. This is the presentation, as described in the Shanghan Lun, is that like 3 or 4 days after when cold attack, the person's in the Shaoyang pattern, they should be treated with Xiao Chai Hu Tong. But rather than treating with Xiao Chai Hu Tong, the doctor treats with a purgative. It's a Sha, right? It got drained somehow, likely a purgative. So my theory then is that the purgative is inducing dysbiosis. The dysbiosis, I mean, there's also the following the classical theory, how you're driving the pathogen in and you're making the center empty, and then where's the evil chi resides below the epigastrium, below the heart, so on and so forth, whatever. Thank you very much. Yeah, I'm hot, I'm sweating, I'm like going too fast, I'm looking at my clock. So dysbiosis, overabundance of pathogenic microbes. This pathway, you see Bansha Sheshan Tang in this larger context. There's so much research on it, and it primarily starts with probably gastritis and ulcers. Gastritis and ulcers present this pathway to cancer, where you end up with gastric cancer. More recently, you see the metabolic function, so it'll be used for diabetes. It's very robustly studied for a number of patterns, but that pathway from dysbiosis to inflammation to gastritis to ulcer to cancer, in conjunction with that, there's another angle of perception, which is the dysbiosis to inflammation to immune suppression to cancer. And so this is where we're seeing this, how we're trying to draw this in towards Bansha Sheshan Tang, its efficacy. If we look at the effect of Bansha Sheshan Tang with chemotherapy, there's a few studies in human populations, randomized controlled trials that show the standard set of improvements, which is reduction in side effects, improvement of quality of life, and prolonged disease-free survival. In this case, in stage 3 colorectal cancer, I think this was the most recently published study of that sort. If we look at trials in PD-1, around PD-1, PD-L1, this is occurring in animal models, so we see that Bansha Sheshan Tang inhibits the expression of PD-L1 through multi-target, multi-pathway regulation of major oncogenes in gastric cancer. These different pathways include the HIF, the hypoxia inducible factor, the epidermal growth factor receptor, and the T lymphocyte receptor. These all contribute to activation of PD-1, so there's upstream targets from PD-1, PD-L1 expression that we can also target that then extrapolate into patterns in TCM that allow us to kind of go from a biochemical view to a more classical view. And in addition to that, it's also found that Bancha Tang increases the efficacy of chemotherapy by reducing the development of drug resistance by inhibiting this MGMT. MGMT is an enzyme which repairs DNA. So part of the way of standard chemotherapy killing cancer cells is by causing damage to the DNA, and then the cells essentially just, they go through apoptosis. So what emerges out of this is, one of the things that emerges out of it is obviously following the whole construct, which is the Huangqin, Huanglian, Renshen, Shengzhang, Dazhao, Gancao. Obviously within that we have the entire Tang family, because Bancha Tang, Gancao Tang, Shengzhang Tang, and Ganjiang, Huangqin, Huanglian, Renshen Tang, these all share those 6 herbs. What gets within the Tang, it's just a modification in dosages or a reduction of Ganjiang, addition of Shengzhang. And then we have, at the bottom, we have the elimination of Bancha, and everything else is the same. And then we move towards the left and we end up at Gugan Qinlian Tang. In Gugan Qinlian Tang, we see kind of the corollary of the initial proposal, which is the article from New England Journal of Medicine, where we have the microsatellite instability case. Here we're looking at using Gugan Qinlian Tang to increase the efficacy of PD-1 therapy, PD-1 blockade in microsatellite stable colorectal cancer. And so then we can kind of answer that question of like, well, what about the population that's not likely to respond? Can we improve the efficacy of that therapy by using, you know, Huangqin and Huanglian, Pararia, the isoflavone from Gugan is also important, but so this opens up the rest of the box, is moving away from the Tang. We can just focus on Huangqin, Renshen, Shengzhang, Dazhao, Gancao, and move into the Tang family. So this is some of the stuff. Okay, and so that's what I'll be presenting on Saturday, and then also an extended perspective where we look at some of these other pathways like VEGF, PI3K, KTM-TOR, and IL-6, and think about standard therapies like invigorating the blood or strengthening the spleen or clearing heat, using external therapies like acupuncture methods in order to synergistically affect the tumor microenvironment. Okay, questions?
I know there's going to be a lot of questions on this one. Where's the first question?
Understand the question about Berberine.
Yes.
Normally, diabetic for diabetes mellitus type 2 is taking as a supplement.
Yes.
Has to do with insulin receptor somehow. This also the apoptotic promoting factor.
I mean, the berberine, a lot of that research travels through the microbiome, and you see a heavy influence upon the microbiome on metabolic syndrome and the way that dysbiosis is intimately related, or the microbiome is intimately related with sugar, carbohydrate, lipid metabolism, and this kind of pathway from the microbiome to the pancreas or to the liver. And so, but it's also part of it, because you start looking at this role, the relationship of metabolic syndrome and tumor metabolic reprogramming, and the way you get glycolysis and upregulation of glucose transport, and you see that in metabolic syndrome that's being treated by berberine over here, but that metabolic reprogramming is also a factor in that hallmarks of cancer. And so by studying a little bit about metabolic syndrome and berberine's role there, you get some understanding of berberine's role in metabolic reprogramming in cancer, and it works along similar pathways.
Next question. Anyone? Well, one of the great things about this is you can think on your questions, because he will be teaching on Saturday and Sunday, I think. At least one of the days, so you can bring them to that as well. All right.
Come on, anybody got a question? I mean, what is a good question?
How would someone take this and apply it to their practice? What would be an easy way that a newer practitioner could apply this information to their practice?
I think that one of the things I like to talk about is that idea of understanding the immune system. And in Chinese medicine, I think like the lowest level understanding of the immune system might be that I use Huang Qi, or where it's like the immune system is Wei Qi. And so if there is a problem with the immune system being hypoactive, then I just need more immune system, and the immune system is Wei Qi, and I use Huang Qi, or something really simplistic and linear like that. And the idea is that if there is insufficient activity of the immune system, I just need to make it stronger. And the real problem, potentially, is that the foot is on the brake. And so the real problem with the immune system is I need to take the foot off the brake. I don't need to press on the gas harder. And if you're just trying to strengthen the immune system in a context of severe immune suppression, you're not really going to relieve the problem. And this opens up the box, essentially, when you start realizing how immune suppression is actually what's causing the hypofunction of the immune system. And I can resolve immune suppression essentially by using draining techniques. I can invigorate the blood, I can clear toxin, I can resolve dampness. All these things, particularly like the blood stasis and the damp phlegm condition, is producing the tumor suppressive microenvironment. And so it allows you to actually be able to treat all the patterns and still relieve the immune suppression, rather than thinking very mechanistically like, oh, there's immune suppression or there's immune insufficiency, so I have to use immune tonic. And you don't have to use immune tonic. What you actually have to do is regulate physiology. And as we create healthy physiology, we'll create a healthy immune system. This fits into the larger theory of cancer and TCM, where we think about those principles like Huo Shui Hua Yu, the invigorate the blood and resolve stasis, and Qingre Jiedu, clear heat and resolve toxin, and so on and so forth. And it fits in that larger hierarchy of Fuzhong Qushe, which is to support the right and eliminate evil. And even in the immune system, you have to figure out where on the two sides of that scale are you at. Is it more important to eliminate evil to strengthen the immune system, or do I need to strengthen the righteous Qi to facilitate the immune system? And that will play out a little bit this weekend as we look how to move through that spectrum from Huang Qin, Huang Lian based therapy to like a Huang Qi Guizhi based therapy. And there are times when you should use Huang Qi, and to recognize where you're at on that spectrum, and having a robust tool set and that will allow you to address, do I need to just focus on Fuzhong, or do I focus on Qushe? I think in cancer, largely, it's about eliminating the excess, what I call pathological end products. And this is a very good way to resolve what is immunosuppression, by eliminating pathological end products that are occurring because of X, Y, and Z. Because of your diet, because of your lifestyle, because of toxin exposure, because of your genetics, because of your fate, because of the stars that you were born under.
We have 2 minutes left. We have time for one last question.
Yes, please.
2 minutes.
给保尔巴从University here and also from Nanyang. My question is, you have pointed out with Wang Lin and Wang Qin as the important factors for handling cancer patients. Now, do you see them isolated, or do they have a sort of hierarchy between the two of them? Do you use them, in a bunch, or is one a catalyst of the other, or how do you define them?
Yes.
That's what.
Okay.
Because most of the time we're dealing with individuals.
Yeah. No. So on one hand, you can treat cancer without using Huang Qin or Huang Lian. You need to match the treatment to the presentation of the patient. And if they don't have damp heat, you probably don't need to use Huang Qin or Huang Lian. I mean, Bancha Tang necessarily indicates that there's glomus and fullness in the epigastrium. So if you palpate epigastrium, obviously there is. So that's where we start looking at the formula families. Like, if there is no glomus, then I can eliminate Huang Lian. If there's subcostal fullness, then we move into the Xiaochaihu Tong lands, and then we're looking at a Huang Qin based therapy. But all the same, it's like I don't necessarily need to use Huang Qin and Huang Lian just the same, because now I step back and I'm like, well, I'm looking at this particular alkaloid, berberine, I'm looking at a particular flavonoid in this class of Baicalin and Baicalin. I can find a way to substitute a similar mechanism using dietary therapy. And so this is what we're looking at, not being I just focused on Baicalin number 1 because I'm just interested in it. For whatever reason, my research coalesced around it. There's a lot of evidence for it. And a lot of this is like what happens because of the mechanism of research. Certain things become a hot spot for research. And that doesn't mean that like other therapies aren't viable. It's just in my storytelling process, I focused on the evidence that was available.
Dr. Ross,
Yes.
we have to go on.
Okay, thank you very much.